May, who's an eye consultant or eye doctor, and today we'll be discussing about diabetic and hypertensive retinopathy. Yes, hope I said that right. Yes. So welcome to the show, doctor. How are you?
Thank you very much. I'm fine, thank you. Happy New Year to you.
Happy New Year. You look amazing.
Thank you very much.
Very rare to find a doctor who looks like this, glamorous. Welcome to the show.
Thank you.
Today we're talking about diabetic and hypertensive retinopathy.
Yeah.
Briefly explain to us, what does it mean? Mulumi or Rafi, like for someone to understand retinopathy, what do you mean?
All right, Dorothy, for most of the patients who have diabetes and hypertension, they can develop some complications in the eye, which can actually result into vision loss. Okay. So, putting aside the retinopathy, it is really a complication of these two diseases, diabetes and hypertension, and that effect is transferred to the eye, and that causes a problem in the eye and results in vision loss. Basically what it does is that in my demo here, this is a part of the eye, half of the eye, but these two diseases cause damage to these vessels in the retina. So these vessels get damaged and some of them bleed.
Oh, really?
So the bleeding results into reduced vision, and then the cycle continues that when the bleeding continues and there is a scar tissue which may form. Okay. So when that scar tissue forms in this thin membrane called the retina, then you are actually losing the vision. And we are very cautious to discuss this disease today because it can result into irreversible blindness.
Wow.
So when it progresses to the end stage, someone has lost vision for that eye, and sometimes both eyes.
You've rushed us. So, katibuli omumrade wa sukali ne pressure.
Yes.
But it did.
No, muntu teetaaga kutya, naye kyetugamba nti omuntu aba teetaaga kulinda kulaba nti eriiso terikyalaba. Omuntu aba teetaaga kulinda kulaba nti eriiso terikyalaba. Kubanga omuntu bw'ajja kweno stage ng'eriiso terikyalabira ddala nga diabetes oba hypertension bye bikireese, then okulaba kuba kugenze.
Briefly, whoever has diabetes and hypertension, they're at risk of losing vision.
Yes. If you don't get check-up, if you do not get treatment, which you need in your eye, the effect which diabetes has caused and hypertension, someone can lose vision.
In a blink of an eye?
It is not really a blink of an eye because this is something which progresses slowly.
Yes.
So, wanene Uganda ogamba kaninda obulwadde bukule.
Kasikajira
chalinda obulwadde bukule. So, ng'olinda obulwadde bukule bukulira ddala omuntu n'aziba amaaso. So, diabetes, omuntu alina sukaali ne pressure talina kulinda obulwadde bukule. Alina kujja nga obulwadde tebunnatandika na kutandika mu liiso.
We kasita omayamba olina obulwadde bwa sukaali ne pressure, tandika okukebeza n'amaaso. In other words, byonna bigende hand in hand. Because you have said it is irreversible blindness.
Kasita bakebera bwoti, omuntu yenna ndaba, kasita bakebera ne bagamba nti olina sukaali, ne bagamba nti olina pressure, yeeyo yennyini essaawa wiiki eyo olunaku olwo ojje tukebere amaaso. To making sure nti amaaso malungi. Dorothy, tewali muntu yandyagadde kubeera nga talaba. Tewali muntu yandyagadde. In fact, okubeera nga tolaba kyongera omuntu okwongera okufa amangu. Kubanga batasobola kulaba ddagala lye, abamu baba balyekuba mu kayisa akatono, buli kaseera okubeera nga oyita omuntu mpempeke zange ebiki ntwala mu toilet. Tewali muntu ayagala kubeera bw'atyo. So what happens is that a person can actually die faster if they are blind.
Sure.
So we do not want anyone with diabetes and hypertension to die faster because they have become blind.
Wow.
We want them to control this vision loss by coming for eye checkup early.
Enough.
Yes, they should not wait to see to first see that there are signs of vision loss.
Wow. Thank you so much, Dr. May Tambula. So briefly now, tell me, what are the risk factors? involved with, because once now you have diabetes,
yes,
you have hypertension,
yes,
there are those risk factors that attain to, you know, having retinopathy.
Yes, so already the diabetes and the hypertension is a risk factor in itself to get this eye disease which we are talking about. Now, there are some patients who are proud, I'm putting it in quotes, proud when their pressures are high. Yes, when the sugars are high. When the sugars are very high, the rate of developing this retinopathy, this eye disease, is very fast.
Okay.
And then you talk about people who have spent 10 years and above with diabetes. So we are talking about someone who has had diabetes, hypertension for 10 years and above. Those ones are at a very high risk of developing this disease. Then those who have, even if you have had it for a year, but your pressures are very high, your blood sugars are very high, you can actually get this eye disease. Then we are talking about lifestyle things like smoking, and then you add on alcohol, and then all of those increase the risk of developing this eye disease faster. Yes.
Age.
Of course, many people who have diabetes.
Someone will say, I'm 38, I'm 40, maybe I can develop that eye sickness or rectal.
All right. Now, as long as one has diabetes,
you're at a risk.
They are a potential candidate. And the message I want to pass on to the public out there, even when you have a relative, your mother, your father, or someone you know was diabetes, all of them are potential candidates for getting diabetes. They are diabetic, these retinopathies, these eye diseases, which cause blindness. And in the population of diabetic patients, 40%, up to 40% already have that disease. So the range may be between 20 to 40%. If you have 100 diabetic patients, randomly 40 of them may have developed the disease already.
Wow.
Yes.
Okay.
Because it is very slow in progression, so someone may not realize that actually their vision is going low until it has actually gone very low.
Okay.
Yes.
It's a scary moment of beginning 2024. But if you've just joined us, it is Health and Wellness. Dorothy is my name. Welcome to 2024. And we're discussing about hypertension and diabetes, which results to a disease which is called retinopathy that affects the eye. We were explaining the risk factors.
Yes.
Now that I know nimurade wa sukari, nina diabetes, nina hypertension, what are the signs? Because I believe there are people who would say, the doctor will give you some take it. Wangaze mbadde kudagala ya sukari, mbadde kudagala ya pressure, na amaso gange ndaba bulungi.
Okay, kakati Dorothy.
Signs. Manya nti amukati esawa nziruko omusawo because
for this evening, Dorothy, njagala okitegeere nti bw'oba olina sukali oba pressure, tolinda kugamba nti lino eriiso terikyalaba kanziruke ewa musawo, oba lino eriiso lirina ekifu kingi kanziruke ewa musawo. Kyenjagala okugamba n'abawuliriza baffe n'abatulaba nti bw'oba olina sukali ne pressure, olwaleero oba enkya oba ku Monday, as in you needed to have an eye check-up like yesterday.
That is serious.
Like yesterday, nti si lwaleero oba si nkya okubanga ogamba ate kati ndaba abandi abaddeyo ku ssomero ate kaninde bino ebintu ebizibu by'abantu tebiggwayo.
Kaninde obwaka butuuke wakati.
Exactly. So point gye njagala okugamba abatulaba n'abatuwuliriza nti tolina kulinda kasita oba ne sukali ne pressure olina okufuna check-up. However, signs z'ogambye nti omuntu otandika okulaba ng'olaba ekifu. Otandika okulaba nga ntunulira gwe Dorothy naye nga face yo sikyagisika bulungi.
Bangi nno we batebe
nga face yo nkulaba naye ndaba nga face erimu zero, erimu ekizikiza. So ezo signs zitandika okugamba nti emabega w'eriiso eno ku retina gye twagambye waliyo ekizibu.
The nerves are getting the pressure.
Yes, they are getting damaged.
Damaged, yes.
Yes. So kati otandika okulaba nti ekifu luli nali ndaba face y'omuntu eno njiraba eri clear. Kati ate ndaba omuntu alimu ekizikiza mu face. Eteeka sitebye bitandika omanya nti ne bw'ojja mu ddwaliro okujjanjaba tuyinza obutakomyawo kyonna.
Wangi?
Percentage yonna ey'okulabako omuntu eyinza obutakomawo.
Wow.
Yes.
It's scary.
Yes.
So it's not about someone who just wakes up in the morning natikako TV like Khalifa Batayina amaaso ne gabeera blurry natandika okulowooza mbu alina sukaali. Is it the same?
Ebintu of course ebileeta okulaba okutali kulungi bingi.
Yes.
Naye bw'oba olina diabetes ne hypertension then eyinza okuba nga etandise okubeera nga edamaging eriiso lyo.
Oh.
Yes.
Now that I've known the damages that are caused.
Yes.
Doctor, what if the stone fell in? You said
yes.
Proud.
Yes.
Because I believe when you start that medication, it's not for everyone. It's expensive.
Yeah.
So Rajagamba, someone will say, but family, but this is a wake-up call, every viewer who's listening, that diabetes and hypertension, every day research is being made.
Yes.
And now when you started about retinopathy, it's a new word to me.
Yes.
It is something that I think the last time I've hosted doctors, they say pressure ya maso.
Okay.
It will pass.
Yes.
But it's on the rise. It's
yes.
on the rise.
Yes.
That now you've said that bova okukeberango or ina sukari or ne hypertension,
yes.
you shouldn't go to any other doctor. Are there specific people that I should run to? Betwagala okumanya kubanga nsobola ogenda wayi ne ngamba pharmacist eriiso lyange lidiriti ate nyina obulwadde bwa sukaali mpaayo ka eye drop.
Kakati omuntu alina sukaali ne
diabetes
ne pressure.
Yes.
Tumuwa amagezi agende mweyo erimu badokita abakebera amaaso specifically. Term of course is hard, ophthalmologists.
Yes.
But tukiganda was abadokita b'amaaso badokita b'amaaso. So of course wano mu Uganda clinics zimanyidwa Mengo, Mulago, Wea, Lubaga, Sambia. So si kuyingira buyingizi mukafunda n'ogamba ngenze kunkebera amaaso. Specifically omuntu anoonye eddwaliro ly'amaaso bamukebere bulungi eriiso. Kubanga it's not just about glasses nti njagenda alifune glasses oluusi nnungi omuntu asobola zifuna naye twetaaga okugamba nti kati Dorothy guno musota guba guyingidde mu liiso.
Doctor wise musota.
Exactly, kubanga omusota bwe guyingira mu nnyumba tosobola kubeera omwo ne weebaka ng'emmese bwebeeramu. Omusota yanga guyingidde wano ffenna tubuukabuuka naye emmese bweyingira yitawo neegenda ne mu kisenge neekola byekola neyekomawo. Naye guno musota ekintu ekitwala okulaba kw'omuntu Dorothy guba musota. Okitegeera. So omusota olina ogunoonya ogukube kubanga it is looking for your life and you have to look for its life. Yes.
And the challenge with the disease we're discussing, retinopathy is that it's a silent killer disease.
Thank you.
It's not something you'd wake up and just someone see here.
No.
You have to go to a doctor.
Exactly.
An eye specialist to check this.
Yes.
Doctor, now that they have found out I have the disease.
Yes.
What are the steps? Because now people are, you've scared some of us.
Now, of course, we have to put the things in emphasis because when we don't emphasize them, that is when we get our patients late. And then we are giving them bad news. Yes, we are going to treat you, but the vision cannot improve as much as you want it. And this is a person who still wants to, of course, even me, I would want to still be reading. I want to be still signing my checks. I want to still be doing whatever
watching
activity.
my TV,
exactly.
Watching Bethany like now.
Thank you. So now, we do not want to be passing on such bad news to people. So that's why I'm saying the earlier the better. When someone comes with, let me say, a spot of bleeding, that is more manageable than when you come when the eye has bled everywhere and they say surgery. Even the patient will be shocked. He's like, I just walked into this hospital and you're telling me surgery on my eye of all places, you know. So it will be even more disturbing to the patient if they come when the disease has progressed so bad, it would be more disturbing to their relatives, because
financially,
you know that they have been through this whole time taking diabetic
medication,
treatment,
yes.
treating the kidney, treating everything else, and then when you come to the eye, they're telling you surgery. You're like, what is going on?
Wow.
So that is why we're emphasizing that it should be the earlier, the better.
So when it's earlier detected, doctor,
yes,
it's still surgery, right? What do you do? You can give us a glimpse, not to go detail. You may scare people too.
No, actually, when we detect early enough, there are different steps that we go through.
Okay.
You know, there are certain patients who would walk into the clinic and then we just say, let's observe. Let's see you in the next 1 year.
Oh, really?
Yeah. Okay. You know, then there are those whom will say, let's observe, control your the diabetes well, control the hypertension well, please do exercise, change your diet here and there, and then we see you in the next 6 months.
Okay, okay.
Without any treatment. And then there are those who will say, oh, now at this stage we are getting into the danger zone, let's start an injection. Yes.
The injections?
Yes.
Okay.
And then, you know, so it is, we progress as the disease is worsening.
How often should one go and check?
Initially, like the way I told you, the person with diabetes and with diabetes and hypertension, they need to have an eye checkup once a year. But if you have just diagnosed diabetes, you need to have checkup of your eyes. Like the next appointment should be with the eye doctor. Yes. So, but every once a year, someone should have a checkup.
Okay.
And then when you have had that checkup of, let me say, someone has decided to come this next week to see an eye doctor, the eye doctor, depending on what they find out, they can say, let's see you in the next 1 year. Then another one, according to what they have found out, it may be the next 6 months, maybe the next 3 months, maybe the next 2 months, or we need to start treatment.
Doctor, pregnant mothers, we all know most of them.
Yeah.
We face diabetes, hypertension.
Yes.
You get those challenges. Okay, you are at risk as well. You may not get it, but you're at risk. Already have it.
Yes.
Now by no kujenemba kebera amaso.
Abachala abaine embuto. Abasinga, of course, ba doctor, ba gynecologist, ba midwives, baba checking a sukali. So, bajamu ababaina risk.
Okay.
Eyokubeera nga oba omukyala afunye olubuto ng'olwedde alina diabetes, oyo olwedde ali ku high risk. Waliwo n'abano abafuna diabetes ne pregnancy tebagiyita na hypertension bagiyita pre-eclampsia or something. Naye abo already nabo baba isolatinga.
Okay.
So omukyala already nga abadde alina diabetes n'afuna olubuto ate oyo naye yeetaaga follow up. Okucheckinga amaaso ge kubanga abakyala abalina diabetes nga alina olubuto ate nabo basobola okuprogressinga mangu okufuna this eye disease. Yes. So they will need check up. Bali abakyala nabo ababeera nga bafunye pressure ziri waggulu nabo of course beetaaga okufuna check up.
Okay.
Yes.
Olwajja ogamba mbu maybe this disease kyabakazi n'abakyala. Maybe abakyala basinga okufuna pressure abasajja. Nowadays we compare, doctor. Boys, men, statistics come out and because of the lifestyles that keep on changing.
Yes.
In your research, bani abasinga okukosebwamu kino ekintu? Medically,
Dorothy, everyone I know these two diseases or one of them is at risk.
Okay.
Ne bw'oba mukyala ne bw'obeera musajja. Ekikulu kasita obeera ng'olina diabetes ne diabetes oba pressure. Kubanga omuntu asobola okuba nga alina diabetes yekka oba pressure yekka.
True.
So buli muntu yenna alina obulwadde obwo obwa diabetes obwa pressure yeetaaga eye check up. Kubanga tewali muntu ayagala kuzukuka nga talaba. Okitegeera bw'obanga toyagala kuzuukuka lunaku lumu nga tolaba ennyumba yo gimanyi naye ndotandika okukwata ku bisenge mpitawo ekinabiro kiriddawo bw'obanga toyagala that result oba weetaaga eye check up.
There is that hypertension that comes older age nekuba lumu amaaso ne gazibira nawo
ekikulu
especially awabakadde
olaba kati ekibeerawo nti patient abo bafuna stroke n'abeera paralyzed half of the body. So because the brain the eye is so connected to the brain naye erugenderamu vision erugenderamu kubanga omuntu ableedinga mu bwongo oba naafuna kyetuyita nti obwongo tebukyafuna musaayi n'abanga tebukyafuna oxygen amala kati kubanga amaaso gaffe this nerve is going and then interconnects in the brain everywhere.
Nerve ziri mmeka nga ndaba blue yellow red
eno yonna kino kyonna nerve. Kati emiswa giyitamu buyisi ne giyingira.
So what blue ne white way?
Blue ne red ye blood vessels. But this whole thing is the nerve. So because our nerve literally is part of the brain. Omuntu bwafuna stroke na bleedinga vision esobola okudisappearing. Oba nafuna stroke gye bagamba nti omusaayi obwongo tebukyafuna oxygen tebukyafuna musaayi gumala still ne vision okulabako omuntu era kukka. So kati ekyo kiri centrally eri mu bwongo.
You're still watching Bethany TV for Health and Wellness, which airs every Saturday from 8 to 9. Well, today I'm quiet. I'm speechless. If you know you have hypertension or diabetes, run to the nearest hospital and check your eyes before, you know, the doctors give you the baddest or the saddest news of 2024. We shall take a short commercial break, but we'll be back.
Bethany TV for Health. Introducing Bethany TV, the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV for Health. Are you ready for this good news? You can now watch Bethany TV on Yo TV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for Health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and AfroMobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for Health. Showing on Bethany TV. Blocked tubes, damaged or absent womb, no sperms, no eggs, or few eggs. What does all this mean? What is IVF and how does it work? So many questions with no answers. Not anymore. Medical Minds is here with all the answers concerning fertility treatment options. This Sunday at 8 p.m. live on Bethany TV with Dr. Andabati. Showing on Bethany TV. Fertilization is never complete until the two haploid nuclei come together, combine their chromosomes into a single diploid nucleus. When the two chromosomes meet, they form a tiny living being that is a zygote that entirely depends on its provider for survival, and that is the mother.
Yes, I've been to the theater 5 times. And all of them have been different.
Welcome to this exciting, informative, and mind-blowing show, A Journey to Motherhood, with Teacher Zita every Saturday, 9 p.m. only on Bethany TV. For health. Showing on Bethany TV. Bethany TV for health.
Welcome back from that short commercial break. My name is Dorothy. Health and Wellness, which airs every Saturday from 8 to 9 p.m. And today in the studio, I do have a lovely lady that is Dr. Tambula May, who is an eye doctor. Today we're discussing about diabetic and hypertensive retinopathy. Before we went for a commercial break, we're emphasizing creating more awareness that whoever has diabetes or hypertension, it's always good to always run to a doctor of eyes or an eye specialist to check your eyes as well, not to just wake up in the morning and you go blind. Doctor, thank you for coming back.
Yeah.
So
welcome.
before we went for a commercial break, as we're discussing, something came up.
Yes.
There are people who already have high blood pressure, who have diabetes, but they already have eye diseases. They're already wearing specs. Yes. So how do you convince them that when I'm say, Mama, we need to take you to the hospital so that we check the eyes, not just because for reading and driving, but also we need to know what is happening back there?
Actually, it is very simple to convince that person.
Okay.
Because almost on a monthly basis, you take them to a certain hospital to get
their
treatment,
medication,
you know, to get diabetic treatment. So the same way you could just say, as we finish this visit, let's go to the eye side.
Okay.
Yeah. So it is not something which should be a tug of war, because these are patients who are visiting the hospital regularly and they are getting medication on a monthly basis or every 2 months or every 3 months.
Okay.
So it should be planned. The only problem is that it is not either known or it is not planned. Yeah.
Yes.
Naye nga tekyandibadde kizibu kugamba taata oba maama oba yenna nti ne maaso tugende tugakebere. Ate in fact ajja kusanyuka kubanga ebiseera ebisinga tajja kugamba nti ndaba kifu oba yajja kulowooza bw'atyo
wayi bwana alaba ekifu nga ateekako specs nga clear vision ekomawo.
No, nedda oluusi babeera nga tebalaba bulungi actually, naye nga talina ngeri gyajja kyexpressinga, ajja gamba abaana balowooza nti ndi kufumba ndwadde. Exactly. Era luusi abalwadde baffe abasinga bagamba maama obwo obukadde, taata obwo obukadde bwe bikuluma, naye ng'ate waliyo ekizibu indeed omuntu kya complainingako.
Wow.
Yes.
So what are the lifestyles we need to change so that we avoid this retinopathy? Lifestyle first of all is to reduce that high blood sugar. Okay. The person should have a discussion with their physician. Our patients should have a discussion with their physicians to know what is their expected
range of blood sugars and also the blood pressure. So because the first effective way to control the developing this diabetic retinopathy or hypertensive retinopathy is to control those two which are causing it.
Okay.
So we are imagining a tree and the roots are diabetes and hypertension.
Okay.
As here we are treating the eyes, the flowers, the leaves, we are spraying, whereas if the roots are not managed, then we are doing nothing.
It's a tsunami coming.
Exactly. Okay. So one thing that has to be done by the patients out there is to have good control of diabetes and hypertension. I know that sometimes it may be hard because of so many factors. But yes, I think with a discussion with your physician and family support, this can be achieved.
Of course, the people who say, now that I've changed my lifestyle, my eyesight is okay. I'll eat a lot of carrots. Okay. And I'll take my medication for that. There are people who don't believe in eye checkups, Doctor. Me, I'll tell you that.
Well, if you don't believe
I was one of them. Until it clicked and I had to run to the
if you do not believe in eye checkup, then one day you'll believe there is blindness.
Sure.
Yeah, when you wake up and your eye is not seeing, not to scare anyone out there, but I mean, if a relative, if yourself, you have diabetes or hypertension, it is not something to joke about.
Sure.
That's what I told you earlier, that, I mean, you know your house very well, but just tie a band around your eyes and see how you'll be able to negotiate into your house, which you know.
You want to know?
You will be holding, you want to touch something, because that is how blindness is. So we do not want for us or our patients to progress slowly but surely to blindness when we are saying, I don't believe in eye checkup. Yeah.
Now that I've checked up,
yes.
One, you've given us an example of injections.
Yeah.
Others, the doctor seeing you and the monitor as you keep on having, the checkups coming through and they check.
Yes.
Others, surgery.
Yes.
Are there, in the long run, complications? Before after having, yes, because after we have had people say bakutekamu irisuriachi, that facial eye, the word they keep on saying, but the doctors really insist that it's not, the other eye, it's that facial eye.
It's not.
Yes, but are there complications? Because there's no one on this planet Earth that doesn't get scared of surgery.
No, Dorothy, I told you that actually the surgery bit of it is also what we want to avoid.
Oh, okay.
That's why we're talking about come early. Don't wait for any signs. Because even when you do the surgery, it will not bring back the vision which you would have loved.
Oh, that's bad.
So it is a desperate moment, even for the doctor who is doing the surgery and also for the patient. Then the counseling will be tugezaako tulawe ng'ofunamu akasobola okutambuza.
Wow.
Okitegeera. Okay. So even as we are having discussion, we do not want to slip to that side of requiring surgery, because then we know that we are just trying our best. But the vision, as I told you earlier, it cannot come back to 100%, unfortunately.
Because of the delayed
screening. I told you that this retina can get scars. If you have a scar on your skin, you know that a scar is not as smooth as your normal skin.
Yes, true.
So if this retina gets the scars, it can never produce the kind of vision one would have required. So all of those are desperate moments saying, you know what, let's do whatever we can do for this patient to be able to get, that vision which will tell you that that is a door and not a window. Yes. Yes.
Wow. I'm happy that we are discussing about hypertension and diabetes retinopathy, because it's something that people, when we come here, we talk about uburadde bwa sukali, bulwadde bw'amannyo.
Yes.
Kumba amaaso, it's a silent killer disease.
Exactly.
I've hosted many doctors and they've always said it, that it is a silent killer disease.
Yes.
And I would like to ask, why now? Because doctors, but they were for almost now, I won't say the years, but
yeah.
How come that we are seeing this information come out now? Are the cases increasing, or the research was delayed to come out?
It has been there.
Okay.
But you know that in developing countries right now, there is a surge of diabetes rising. So we are having many people getting diabetes, even at a lower age.
Yeah, true.
Earlier it seemed like the elderly. But now you see people in their 40s, people in their 30s, 20s, even younger, yes, getting real diabetes. So there is an epidemic. You know how we got corona here and everything scattered? There is a silent epidemic called diabetes.
Wow.
Yes, that people are moving on the streets and they have diabetes and they don't know. People are moving on the streets and they have hypertension and they don't know.
True.
And then someone just collapses and everyone is running away thinking that they have, you know, some strange disease. But when it was, maybe they got a stroke when they are walking. You know, we have many people you have had who are not waking up from their beds.
Oh, yes.
Because of the high pressures that they have been walking around with, and then a time comes when they just stop. So there is a silent epidemic called diabetes. So there is a lot of lifestyle which we have adopted.
And we are enjoying it, doctor.
And we are enjoying it. You're here, Dorothy. Yes. You came driving, you came seated.
Yes.
So you are here on this show, you are seated. You're going to go back home seated. Then you sit on your TV to watch seated. So at the end of the day, literally, you haven't even walked a length this much, like this studio. So doing that over and over again will cause the body to like collapse and then just start doing its own things, and then someone develops diabetes. We have forgotten probably about exercise. We have forgotten about walking. I'm glad, you know, after Corona, people have gotten that habit of walking.
Doctor, if you, I want to get one day.
Oh no, but yeah, I'm doing it anyway. I walk many kilometers. Yes. But many people have actually developed that habit. Now it doesn't seem strange to walk, you know, but you know, because of the lifestyle which we have gotten, we are snacking a lot with so many fats. You know, you run from chips and chicken to chips, I don't know why, because it seems to be fancy when you're talking to your friends. It's like,
Doctor, it's not fancy, it is cheap.
No, it's not cheap.
Local food is expensive.
No, I don't know.
Local food buffet, 25. Chips, chicken, 15K.
Yeah, so, you know, doing that over and over again, then, you know, you are storing fat with that kind, you know, you are seated, coming, everything you're doing seated, like the body is not using that fat.
Very true.
So then the body starts, you know, misbehaving and causing all this.
Doctor, let's talk about self-medication.
Yeah.
I'm one of them. I've already said it.
Yes.
We love self-medication. I believe even whoever is watching me right now, tuchogeddeko brother wa pressure ne sukali, agenda mbire mpeke yeye bake.
Yes.
Then ekyakuma kyawa udi aka vision aduke omusawo afune eye drop or a pharmacist.
Yeah.
How dangerous is that?
Self-medication in eye is actually dangerous.
In fact, in anything. So even eyes, doctor.
No, you know why I'm saying eye? Is that when you wake up and your eye is not seeing, you'll be traumatized.
Very true.
You'll be too traumatized. Imagine if you have to come to call someone to take you to the bathroom. You know, it is embarrassing.
Yes.
So now when someone with diabetes and hypertension, I would not advise. I would not advise you to put eye drops before you have an eye checkup, because some of those eye drops can even, it's like a fertilizer for this disease.
Wow.
Yeah. And when you go to the pharmacist, they want probably to make money or whatever, they'll just give you. Yeah, so very important that someone who already who has diabetes or hypertension, they already have very high risk of developing eye disease. So when you add on something to kind of like fertilize It will be very unfortunate.
Manure.
Exactly. Yeah.
It is scaring, by the way. On a serious note, it is worrying that you find people that have these deadly diseases and hear that there is another one coming onto. It's scary because I think it was there back then and people were like, exactly. But now the doctors have come out to say this out loud. I think it's a great awareness, and I think as Bethany TV, I'm happy that to host you people. It's something that everyone needs to know. But doctor, now that you back earlier, you mentioned that the nerves.
Yes.
They burst. What the blood stops moving? What exactly happens? When it bursts, does the eye turn red?
Now we're talking about
it's the back of the
blood vessels.
Okay.
The blood vessels which bring blood to that thin layer inside our eye, called the retina. And those blood vessels. So this is what happens. Let me explain to you. You will understand.
Layman's language.
Yes. Now, imagine a scenario when there is a lot of sugar in your blood.
Okay.
When there is a lot of sugar in the blood which has been there, after food, all of us normally we get that surge of sugars rising in our blood. But because the blood has a way of removing much of it, and then it goes back to the normal. So what happens in this chronic high blood sugar, for example, so the patient is moving around with very high blood sugar, let me say 15, 16, 17, 20. What happens is that the blood itself starts becoming thick.
Yes.
The liquid blood becomes a bit thicker. So when it becomes a bit thicker, it's not moving as it should have moved. So that means starts clogging into the blood vessels. And these blood vessels we are talking about are micrometers.
Micro, you mean very thin?
Very thin.
Okay.
Yes, very thin blood vessels and very fragile. So imagine blood moving and stagnating, being there for a longer time than it should be. So that blood vessel starts becoming
the
damaged.
blood vessels on the screen are the red ones, right?
Yes, these ones which are bleeding.
They are like branches.
Exactly.
Or the ones that are already bleeding.
These ones which are bleeding, those small blood vessels have become damaged.
Oh, yes.
Because the blood was staying there for a longer time than normal. So what happens is that blood vessel gives way, and then there is bleeding.
Okay.
And when that bleeding occurs, you see that area which has bled, it means that wherever that blood was going is not reaching.
My God.
Do you understand that?
Now
so that means that that area which was supposed to get that blood starts becoming dying off in a sense. Because when you tie your finger for a longer time, it's not receiving blood, it dies off.
Yes.
So that area which was supposedly supposed to get this blood, which has been spilled, starts dying off. And as it starts dying off, the body is thinking there's no blood in this area, we need to form new vessels there. So as the body is thinking about that, it starts bringing let me say like bricks to make new vessels.
Okay.
You understand?
Okay.
So as the body is making new vessels in that area which has not been receiving blood, those new vessels are very fragile. Then bleeding occurs again. You see all of that eye? How the bleeding has occurred everywhere. Yes. Meaning that it has been a cycle that there are areas, those which had yellow spots, they don't have blood. So the body is thinking we should create more vessels to put in this area. As those new vessels are formed, they are very fragile, they bleed. So that area which is bleeding a lot will form scars eventually.
Oh, yes.
So that person will progress to scars in that area. And we are talking about a very smooth membrane. When it starts getting scars in that area, then it starts getting scars, so that is already a massive bleeding, and that where you're seeing they are formed those scars, those yellow dots.
Yes.
It is the best area of our vision, around there in
so
that
it's getting
center.
Damaged.
It is damaged.
It's damaged.
Yes, because when you look at that place, when you cut through, for example, you will see that it is swollen. So when the retina becomes swollen, I'm telling you, the vision is reducing. So when, for example, when the person moves from that, they are going to form scars.
Wow.
They are going to form scars, and when they form scars, the liquid, there is a liquid in the eye. It is going to start pulling on those scars, and then the retina is going to be removed, and that is what we are calling blindness. So the end stage, blindness.
So the more, so this is not even about you scratching the eye.
No.
Or you manage it.
It's inside at the back of the eye, in the retina. So this picture here is showing an eye which had like the other bleeding, but those dark spots are laser.
Oh, okay.
A laser was done in those dark spots such that they can save some small vision for that patient.
Oh,
yes.
That's wonderful.
Yeah.
Thank you so much, producer. I think that has been so insightful.
Yeah. Yes.
But now, doctor, this is worrying, you know, because when we look at the eyes, if a stone just enters, you know, our eyes, you just want to cut that eye out.
Exactly.
Now imagine that is going behind the eye that you don't know.
So that is going behind, most likely that patient does not have pain.
That's why we call it a silent killer disease.
So that patient does not have pain, but what is awakening them is that the vision is reducing. You know, I was able to see up to that distance. Now I can hardly see here. What is happening? But remember that when the tissue becomes the way we have been shown, we have lost much of vision. We have lost much of the vision.
Doctor, the Sembu eye specialists are expensive. No, that's the, because medication is expensive. Everything is expensive. But I know what you would say, but I would like to hear it.
This is my answer to you. How much was the kilogram of sugar in 2000?
Do I remember? Was I born?
I don't know, but okay, let's put it.
But I think it was 1,000 or 500.
Let's put it nearer. In
2 years
2020.
Back. Yes.
It was at 2.5.
Yes.
Today, how much is it?
5.
Thank you very much. So even as eye doctors, we go to the supermarket and we buy a kilogram of sugar at that price. We take children to school. You know, we have to manage all the things we are managing. So it's not really just about being expensive, but I mean, even as you come to a doctor, you don't expect the doctor not to be paid.
True.
Yeah.
But your life is precious. Once you become blind, that's when you see the importance of money.
Yeah, of course. You know, that is when you have to hire a personal assistant to take you around town, to take you to the bathroom. I mean, Dorothy, imagine. I don't want it to happen to any even of my patients. Yes. Even when I don't know you, I don't want blindness to happen to anyone.
Have you seen it happen to any patients of yours?
Yes. Of course.
And I think you'd be devastated.
And then you have to talk, and then you don't know because you can never be in someone's shoes.
Very true.
I mean, you are talking to them and they're like, for you are saying, what are you talking? You get the point?
Yes.
So even me, I do not want to be in a position to counsel someone who has gotten blind because of diabetes and hypertension. Because I will never be in their shoes. And even them, they'll be saying, you're talking like that because you are not in my position. Yeah. So it is not really about money, but as I told you, the checkups should be routine once every year. And I told you that this person, whoever has come, someone may be that we can say, let's see you after 1 year.
Okay.
Another one we can say, let's see you after 6 months. Another one we can say, let's see you after 3 months. So it is not really. The problem is not money, because but it's priority and attitude.
Your last words, because now I'm scared of you, Doc. Now I don't know whether I should go with you today and I check my eyes, I make an appointment.
Someone needs it like yesterday,
okay.
you know. But I want to thank Bethany TV for this opportunity. And if I am given another opportunity, I would gladly be able to come back. And then to our patients, clients, if you have a relative, you know a friend, if you know anyone, even a neighbor, even someone at your workplace who has diabetes, kindly advise them to have an eye checkup. It is not just about money, but about how am I progressing? Because I told you that if we catch that retinopathy, that eye disease happening earlier, the better you'll actually not spend more. Because as you move from the injection to laser, the expenses are increasing. To surgery, it is even more expensive. So I told you that we don't want to sleep there, and we also do not want to slip into blindness.
Thank you so much.
You're welcome.
Well, thank you so much for being part of this show now. It is sad that I have to end here, but do remember, this show has a repeat every Sunday at midday, that is 12 p.m. And also you can watch us on YouTube channel, that is Bethany TV UG, our Facebook, Twitter, and Instagram. We are all there. But do remember, you can watch us on any other platforms. Guess what? Before they are ended, we're already on Star Times. So if you have someone that has a Star Times decoder, tell them that, hey, there is Bethany TV for health. Anything related to health, you don't want to miss it. For now, I would like to sign out. Do remember, tomorrow is Sunday. Let's go and worship the Lord. Good night.